Hello everyone, my name is Laura Gomez and today I'm going to be talking about psychosocial problems. Psychosocial problems are often very common for elders due to their decline in health and limitations in engagements in occupations. It is important to understand the root of the psychosocial problems to help address these issues. What's affecting a person, it might not be the same thing that is affecting another person with the same condition. As an occupational therapist, we can not only understand the connection between occupations, health, and the psychosocial issue, but also we can create holistic and client-centered interventions to address these issues and addressing occupations as well. I believe that one of the most effective interventions to implement in an adult day care are group intervention activities. Group activities can address several psychosocial issues such as social interactions, anxiety and depression management, as well as health and wellness. By using coping mechanisms and teaching the elders these mechanisms of coping. The group activities will focus on social interactions and management of depression and anxiety using coping mechanism skills. The purpose is to create a group activity with patients suffering from similar psychosocial issues, facilitating their engagement with each other as well as in the environment during the group activity, using different activities and skills that they can develop in their group treatment. Some of the activities included in the group are stretching and exercising, targeting wellness and health management, also using educational flyers and information for them as well. This activity can be used as an icebreaker to create the setup for the group interventions. Patients can introduce themselves and talk a little bit about what their activities and what exercises they do daily to maintain their health. Another of the activities can be an arts and craft activity. Of course, this is optimal if it's done in groups of 2 or 3 and they can perform the activities that they preferred. These activities not only facilitate their fine motor skills and coordination as well as cognition, but also it can be used as an anxiety and depression stress relief techniques, and it also helps to increase the mood. Then charade games can be implemented as a third activity to increase energy and promote laughter and promote social interactions as well between the members of the group. Hopefully, these interactions and social connections created during the group activity will be transferred outside of the group therapy. The cognitive behavioral frame of reference creates the perfect link between the environment, thoughts, and feelings, which in turn affects emotions as well as interfering with psychosocial issues. So I think this frame of reference is one of the best to be used during group activities because it encompasses everything that we're trying to address. The group therapy can be adapted to patients with less impacted occupations due to the psychosocial issues. So we're talking about patients that have, instead of more like emotional and psychosocial issues, but they have cognitive issues, physical, decreased strength. So these activities can be addressed, they can be graded, they can be made more difficult for these patients, more challenging in a way that you are addressing not only their psychosocial issues but most underlying conditions such as coordination and strength, like I said before. And this can also be done in a group activity, which is why a group activity is so important and so helpful in these settings. For future group therapies, I will involve a second person, either staff member or another therapist, just because working with 10 people at the same time when you don't have an assistant or someone that can help guide the activities, it can become a little distracted for the patients. So I will say having another person, especially a staff member, someone that has rapport already with these patients, so they can help guide the intervention process, and this way you can increase their interactions and minimize the distractions while we're doing the therapy. um, in conclusion, the group activity is a fun and interactive way, and all the patients reported feeling great, feeling better. They all asked if the activity can be done again. They all gave suggestions and reviews per se. Taking care of our elders and their psychosocial issues is as important as taking care of their mental and physical conditions, because psychosocial issues, when they're not addressed, they can severely impact the elders' function in their daily life, and in turn affecting how they perform their occupations. Thank you.